Well, I'll start then, if that's okay. Unless Mark has a different plan, but is that okay?
Yep, good.
Okay. Bob, obviously we were listening to the governor. We know that our restrictions have been lifted, some of them, the yellow, orange zone restrictions. I'm wondering just what your conversations have been like with school districts. The testing is not required anymore, but with high school sports coming back, I'm sure there's a lot of parents wondering, many of them will just continue to test voluntarily. And will they have the resources to do so?
Well, first, we've had a number of discussions with school districts, superintendents, and others leading up to the governor's decision to open up sports, which I would say has been super positive. The response you probably have seen has been overwhelming. And having played sports in high school and college, I really felt for these kids who, their junior and senior years, what it means to get back and play and maybe open up opportunities for scholarships. In terms of how this will affect that, we have not gotten that far yet. We heard the announcement today. We don't get any advance notice on this. So all we know is that the orange and yellow cluster zone guidelines have been lifted, with the exceptions being some areas of New York City, which I think is good. We're back to the other originals, which I'm happy to go through if you want me to. You might have those available, but if anybody wants me to, I can go through what those are. Retail and personal care, 50% capacity. Gym and fitness centers, 33% capacity. Gatherings, residential limit, 10, non-residential 50, restaurants outside of New York City, 50% capacity, 10 people per table, still a 10 p.m. closing time is still on. And so it reverts back to the phase 4 guidelines that we had before. But the cluster zones, at least the ones that came up that, as you know, from the media and really from people that have advocated with us, there's been a lot of questions about that. And I really appreciate the governor making that announcement today. I think there's a lot of people that are happy. But it does not mean we're out of this altogether. And Jen, going back to your point, I do think as sports come out, like we test with salons and other places, that issue has to be revisited. I would really defer to the Department of Health and Governor's office to clarify their position on youth sports and testing. But my sense is with February 1st being next Monday, and with the sports being open again as of next Monday, I think those communications should be happening very soon. I'm not aware of any yet. I've not been asked by district, and I also want to say we are on the phone every day. Our job is to interpret what comes down, but to also send feedback back to the governor and the governor's team about what we are hearing from these business owners and employees here. And I would say we've done that consistently well throughout this. And when the governor makes decisions, it reinforces he does listen. I can't speak for other regions. I know that they are tired of hearing from us. They hear from us all the time, but I just appreciate their responsiveness, their willingness to listen to our concerns, and we've raised those time and time again. I also want to reinforce, I think you guys get it, we do not lobby publicly. We don't get up, and I don't make statements on social media and all the great social media leadership out there who expects us to fire these salvos every day. It doesn't work that way. I go back to my first week as mayor, when I was told by one of my colleagues, you have to have a press conference slamming Albany. I'd never been in politics before. I'd never been in elected office, but I said, well, let me apply this logic. You're telling me to slam Albany with a press conference telling us to send them more money here. That is akin to me as a teenager having a podium outside my house, criticizing my father, then going inside and asking for a raise and allowance. It doesn't work that way. You be respectful, you work behind the scenes, and that's what we do. We are relentless on this, but anyone wanting us to make some outlandish comments publicly, it doesn't happen. These are friends and colleagues and co-workers we work with, we advocate with them, and I'm very proud of the fact that I can't think of one issue from this region we have not consistently brought forth data, feedback to those making decisions so they can make other decisions in the future. And I think today was just a manifestation of the governor's team and Department of Health listening, seeing the data, and making this decision today, which, while it's not back to normal totally, it's a great step forward.
All right, folks, if you have a question, feel free to put your name in the chat box. I believe Andrew Banis from 13 WHAM did have a question, and let's see if he got his audio worked out.
Let's test.
Yep.
Does that sound okay? Okay. All right, great. Bob, I have one question and a quick follow-up, if that's okay. The first one is this enough, you think? I mean, business owners are happy to hear this news today. Restaurants, people have really been struggling to hear that a lot of the restrictions they've been dealing with have been lifted. But is it enough, you think, to help those businesses that have really been struggling? Is this too late, or is this enough, or what else can be done at this point to make sure they can get back on their feet?
Well, I think getting back on their feet is going to be a long-term project, which they need a lot of help. The pandemic is not over. As you've seen and heard, we're going to get 16% more vaccines coming to the state. It is not an issue of demand, it's supply right now. So we really are having a hard time getting enough supply here. The assistance the governor has put forth for restaurants, he's put that out already in terms of tax credits and tax relief. I do think this has to be a long-term project. It has to be about relief. I think this next stimulus package the feds are discussing right now, everybody in America does not need a stimulus check. I'm sorry. Those that need it the most should get more. Those that have been decimated in their businesses, those that have been out of work, those that have maybe been on the edge of bankruptcy, I think we need to look at trying to make sure you put the money where it's needed, and it has to be a long-term investment. And I think we have to look at, in many ways, what are these stressors? I do think a business, especially small and mid-sized businesses, which have been really hit so hard during the pandemic, it's nobody's fault. The governor has a responsibility to take steps to reduce the pandemic. But now that we're getting out of it, can we relieve them of other things? Can we relieve them of sales tax payments, property tax payments, other things, other regulations that they are mandates that they are operating under? Can they be given relief for the next year or two? Or it's, it may reduce revenues in other areas of government, but it helps them. It's, to me, everybody's got to have a little give and take. So it has to be a process. This is not a one shot because it's restaurants. But give you an example: Seabreeze Park. Seabreeze. I've gone to Seabreeze as a kid. I've taken my kids there. Last year, Seabreeze Park did not open. Not one customer or child walked through that park. An entire year, where no revenue coming in. But I'll guarantee you, the family that runs Seabreeze, the Norris family, probably has to pay taxes and other things coming up with not any money coming through. And I mean, those are the businesses we have to get behind. And it really has to take federal, state, and local support. Everybody has to give. And I hope that is something that is going to be at the forefront. We're pushing for it every single day to try and get that at the forefront. But it has to be a well thought through plan throughout the next probably year and 18 months at a minimum.
Thanks, Bob. And quick follow-up to this is, I know this is effective immediately, the zone lifting. And the second question, though, is I'm having a lot of people who still are confused about exactly what that means. Is there a place where they can see exactly, here's what restrictions are still in place and which ones have been removed? Is there a place they can find that information that we can point them towards?
Yeah, it's the forward.New York gov or forward.New York is the website, forward.newyork.gov. So forward.ny.gov is a website, has the guidelines, and it's often where we get the updates too. So these information announcements, they don't come out ahead of time. When the governor makes an announcement, he's the first one to make it. So we listen, we go back, and we try to interpret what's coming down and try and get the information out. But on that website, we'll put it out on our social media channels as well, just people can refer to that.
Thanks, Bob.
Thank you. Thank you, Andrew. The next question is from Atia Collins from News 8.
Good afternoon, Mr. Duffy. I'm wondering if you can kind of give me a trajectory of what these lifted restrictions mean. Does this mean that in a while we might see all the restrictions lifted, or do you think that this is kind of the end game, that we're going to have these restrictions in place until this pandemic is defeated?
Great question, Tia. I would say that we're not going to be back to total normalcy for a while, because until people are vaccinated, until these numbers drop down to just the absolute ground level, there's going to be some. But I think today the governor's announcement is showing that, with the data showing downward trends here and around the state, the vaccination process underway, although needing more supply to make it happen, we're getting to a much better place. We are. So as that happens, the restrictions start to basically melt away or get reduced. I think today's announcement is excellent for the orange and yellow zone restrictions being lifted. That was very controversial in some areas in terms of those clusters. So that's being lifted back to phase 4 guidelines. The youth sports, a great push right now. So I think right now people are getting back to a maybe closer to normalcy, not there yet, but this pandemic is going to be a journey. And what we don't want is 2 or 3 new strains coming and going back to more restrictions. But if you look around the globe, I know London, I look at some of the international news, some of these cities around the globe are basically empty. There's other cities have and states have a lot more restrictions. Some have far less. You know, it's each governor has to make his or her own decisions. But I thought today shows it just gives me hope that, you know what, we're on the right trajectory now, that we're seeing progress, and that progress is being rewarded with less restrictions. And I'm sure no matter what gets reduced, somebody will complain about it. There's always, every day we hear about those that if 99 things are lifted, that one thing will be a source of contention for some. But I feel very good that we're on that path. We're getting there. And I do think this is smart. The pandemic is not gone yet. The vaccinations, percentages of people that need it in terms of essential workers and regular citizens, we have not hit that threshold yet. But I do think as we get into spring, maybe by June or July, we're going to be beyond that. And I'm waiting for the Johnson & Johnson shot, which I understand, A, is very good, and 2, it takes 1 shot, not 2. So that if that comes out and gets approved by the FDA, that may even expedite some of this. But, you know, a great example of sports, the Buffalo Bills. The Buffalo Bills had some COVID issues this year, but by and large, they test, they're careful. So it shows you can do things. There are activities you can do. And by the restaurants, while the closing time is not changed yet, I think the governor said today he is considering that. We'll talk about that. So that's something that is certainly on his discussion list. But our concern in the past was too, if the restaurants close at a certain time, say the Buffalo Bills game is going on to 11 and they close at 10 o'clock, are people going to go home by themselves? No, they're going to go to a friend's house. So you might get 30 people in a house watching the game, which in all honesty causes more concerns with infection rates. So I think little by little, we are getting there. I watched today like everybody else did, and I was very happy to see this. And it just, to me, it's just one more step back to normalcy. We're not there yet, but we're getting better and better all the time. So it just gives people hope and confidence that the end is coming at some point.
Thank you, Atia. We now have Lowell Rose from Spectrum News.
Hey, Bob, it's Lowell from Spectrum. I have a 2-part, can you hear me?
Yep, I do. Yep.
I have a 2-part question. And one, I know a lot of business owners felt as though the lifted restrictions came too late. So it's kind of, do you feel like this is too late or do you feel like it's too fast? And the second part of that question is, what is like the fail safe as far as numbers when they go back up? What would transition back into our area going to a yellow or orange zone, so to speak?
Great question. First of all, you know, if you're in business and your business is closed, people say this took too long, it came too late. If you are in a community and are worried about infection, you may say this went too fast. I mean, we hear all sides every day in terms of people who are afraid of reopening and people who say we can't reopen fast enough. And there are, you know, different schools of thought out there. I think the most important thing is the governor is making this decision today. The numbers are going down. Look at the dramatic drop we've seen in the Finger Lakes region just in the last few days. So we were one of the highest in the state. It is dropping down. So we're seeing those changes, which are great. And the most important thing is, you know what? It's happening. And I think what we have to do is 2 things. Open safely when it's safe to reopen. And number 2, rebuild those that have been most impacted. As I said previously, we really need to have a much more strategic focus on these businesses and families that suffer the most. Pardon me. Any stimulus plan should be targeted, not across the board. Everyone in America does not need a $1,200 check, but maybe 25% of America need a $4,000 check or need something else. I think we have to look at who needs it and make sure they get it. And there are a whole lot of things that businesses have to be provided. And I would start with relief of sales tax payments, property tax, other payments they're paying right now. Give them relief now so they can stay in business. Because if we don't, if they go out of business, we lose that business, we lose those jobs, and we lose that revenue. So everybody has to give in a little bit, and it's the federal government, it's state and local, so everybody's involved with this. But I do think it takes an across-the-board approach to help them, and it's going to take maybe 1 to 3 years before they're back to normal. You cannot recoup those revenues very quickly. And I also fear that as you reopen, it doesn't mean people will flood into your business. There's still a lot of fear about getting back to going in around crowds and being around people, which is why people have deliveries and Instacart and all these other things that they're doing. It's why all these streaming services are making great money, you know, and home TV versus going out. I just think that it's going to take time for people's fears and concerns to maybe fade away and get back to normal. That takes time, but I think we need to have a plan, and we need to reinforce that. And I would say small and mid-sized businesses, there has to be a huge emphasis on them and the owners and their employees as a priority right now.
And what would be that trigger to go back into a restricted space going forward?
I think the big thing the governor looks for right now, the most important thing would be hospitalization rates. As our hospitals get overwhelmed and it gets up, and there's times in the last few weeks, we have 2 great systems. We have probably one of the best healthcare systems for a community our size anybody can ask for per capita, but those resources were getting strained. That will be the trigger point. If hospitalizations go up, if staffing gets reduced, bed space gets reduced, that is where you'll see it. And I don't want to give a number and have it be a higher number, but I'm on calls probably 3 days a week with the hospital systems. They're doing a tremendous job right now, but it's not just space for them, bed space, it is staffing. And the staffing has been stretched. And there's been adjustments made with nursing homes for COVID-only patients. There's been a lot of partnerships between URMC and Rochester Regional and private sector providers. So this community has really done a great job working together, but the key issue will be hospitalization rates as they go up. And I think that if it hits a threshold where hospitals are being overwhelmed, that's when you'll see things dial back. And Lowell, we hope we don't get there. We hope that we're going in the right direction and we stay on this path.
Thank you. Our next question is from Randy Gordman at WXXI.
Hey, Bob, how are you?
Hello, Randy.
Hey, quick question. I know we're talking obviously about the big impact on small and medium-sized businesses and the fact that lifting some of these restrictions, could help them. What about the local economy as well, the greater Rochester area? The governor made reference to, how some of the restrictions obviously affect state sales tax. There's the local component to that. Of course, there are local jobs involved. Do you think lifting the restrictions in the microzones will have any, appreciable positive impact on our local economy here?
I think it will. I think it's a step in the right direction. It might not be opening the numbers up to where every business wants it to be right now, but you know what? It's a step in the right direction. It's going to help. So it is, we're on a journey and it's a marathon. It's not a sprint. So we're going to be end up probably for several months going through steps along the way. But I think today what it does do is it really reinforces, builds maybe a much more positive spirit that we're getting back to some sense of normalcy. We are not there yet because there are still restrictions. We'll make those available to if you don't have those. They are still in place, and some may disagree with them, but it shows that a lot of the ones that were in place before are being addressed and being reduced. So we just want to keep this going, and really a lot of us, we have that responsibility. If we wear a mask, we stay 6-10 feet apart, we disinfect our hands, our workspaces, all those things. We follow those rules. It's going to be good. We're going to end up making those numbers go down. And I would say on a personal level, I have not even caught a cold in the last year. Why? Because I lead a pretty boring life. I mean, I'm at work, at home, and pretty much maybe stop at a grocery store once a week, masked on, but that's pretty much it. We don't do anything. We don't socialize. It's not been a great year, but in many ways, it's been a healthy year because we've stayed away. And it's hard. It really is hard to do that, especially I feel for people who live alone. If you're by yourself, it can have just such a detrimental effect for being by yourself for long periods of time. But we are getting there. We're getting those numbers back up. And again, I know the 10 p.m. closing time has come up a couple times today in emails and phone calls. I did hear the governor say they are discussing that. So I would never want to predict what he may or may not do, but he is, at least he's discussing that right now. So we just stay tuned and see if that's going to change in the near future.
Thanks, Bob.
We are all set with questions. Shannon Ely, our communications director, has posted a link in the chat, which gives you access to a great deal of information that Bob referenced. So feel free to check with that. Thank you all for your time today. Have a good day.
All set. Good. Thanks, guys, very much. Thank you.